Hello everyone, this is Dr. Pravit Patel and today we are going to talk about orthodontics. So, orthodontics is a pretty important subject. It comes for at least 14 questions. Usually, orthodontics is more of a concept based and less of a mugging up subject. You need to understand the concepts clearly. Once you understand the concepts clearly, you can attempt any question and you can arrive at the answer for most of the clinical ones. There are usually 14 questions, out of which 10 are the easy one, 2 will be like moderate difficulty, and the remaining 2 will be extreme difficult. But I think you can easily attempt all the 14 and you will get at least 12 of them right. So without wasting any time, let's begin. Let's move on to the first part of the subject, that is the contents and the sources from where you have to refer ortho properly. See, in the colleges in India, there are some of the most common Indian writers' book that are taught are the Gurkirat Singh, Gauri Shankar, and Balaji. In my college, we used to be taught Balaji, so I referred Balaji during my undergraduate and also referred that during my NEET preparation. See, books like Prophet and Grabers, you can refer them, but my advice, my suggestion is that if you have read them once, then you can refer it. You will know where are the topics, where are the points, you will know because you have read it once. But if you start reading a new book afresh, you will take a lot of time, and trust me, you don't have that in your preparation. So my suggestion is that just stick to your normal books, refer them. If you cannot find a particular question answer, then open these books, else don't. And other than this, refer the synopsis of Pulse. You have to learn it, mug it up, and yeah, that's it for the sources. The most important topics of ortho. Okay, I'll begin from a particular point. Just remember that these topics are the most frequently asked. These are not all the topics that you only have to learn this much. These are the most frequently asked, and I'm only gonna give those topics. You have to add some topics yourself which you see that are asked. I might miss some, but yeah, these are the frequently asked and I referred them mostly. So let's begin. In the basics of ortho, you have to remember the Jackson's triad, scientist name. They usually ask that this is Anderson's appliance. What is this appliance? Like questions like this is Frankel's appliance. You know the Frankel's appliance. They ask questions like this, so you have to remember which scientist gave which appliance. Moving on, principles of growth of development. You have to remember Scammann's growth curve, cephaloglottal growth gradient, theories of growth, name and scientist, and the basic idea of the theories. Functional matrix theory, very important, Melvin Moss, and Lowe's V principle. Then moving on, the embryology of head and neck, arches, from which arch various muscles, bones, and nerves develop, bone size and growth, how the bones of the skull grow, and the processes of the face like the maxillary process, mandibular process, palatal shells. You have to remember when they fuse, when they are formed, and when they are completely developed. See, in development of dentition, we have to remember the periods: prenatal period, deciduous period. In the prenatal period, we have to remember the gum pads, deciduous, the primate spaces, that is the spaces of bomb, flush terminal plane, mixed dentition, ugly duckling, very important, permanent dentition period, sequence of permanent dentition and primary dentition is very important, the eruption phase, the formation of root, the completion of the crown, the development of the buds, in what time, in what age it occurs. You have to remember the chart. There's a chart in the Wheeler, so you have to refer that. Then moving on, buccinator mechanism. Buccinator mechanism is very important. You have to remember occlusion. In occlusion, you have to remember curve of Spee, Wilson, and Monson, Andrew's 6th key of occlusion, and also the 7th key, that is Bolton's ratio. In classification, in the classification of malocclusion, Angle's classification, Dewey's modification of Angle's classification, Simon's classification, it is based on the 3 planes, FH, orbital, and sagittal. You have to remember that. And Ackermann's classification, it's a Venn diagram based. You know the Venn diagram, it's round. So it's a Venn diagram based. It's very important. It has a very normal, very easy mnemonic I made. APT-CB, APT-CB, alignment, profile, transverse, bite, and clasp. I'll put up how you have to use that. Okay, moving on to the next chapter, habits. Classification is very important. You have to remember that. Sometimes they ask. Then habits, thumb sucking, tongue thrusting is a very important. You have to remember the classification of Baum and Holt. Then simple and complex tongue thrust, the differences. It was asked in the 2024. Mouth, breathing habits. You have to remember the clinical feature. For all the habits, you have to remember the clinical features and how it can be corrected. In the chapter of diagnosis, you have to remember the types of lip, facial profile, facial divergence, cephalometric, head sizes, and various classification which are given there. In cephalometrics, you have to remember the hard tissue landmarks, soft tissue landmarks, and the derived landmarks. And the analysis, Downs, Steiner, Tweeds, and Ricketts. These 4 you have to remember. There are many more, but these 4 you have to remember. Moving on, width appraisal, broadband triangle, Jara-Bax ratio, and Jork value. These are some of the topics in the cephalometrics you have to remember, or just understand the concepts, how they are derived. Moving on, in the skeletal maturity indicators, Fishman's skeletal maturity indicators, the names of the carpal. There's a mnemonic for the names of the carpal, so remember it like that. CVM, that is cervical vertebrae maturity indicator, we have to remember that. So I think these 2 are important. There are many more skeletal maturity indicators, but these 2 you have to remember. In model analysis, Carey's, Ashley House, Bolton's. In the mixed tooth analysis, Moyers, Hokaba, Tanaka Johnson. Color coding of SEP. You have to remember the color coding. See, it goes like pre-treatment is black, treatment is blue, post-treatment or completion is red, and retention period is green. So these are the tracing colors of the tracings, various tracing. In the biomechanics, we have to see the physiologic tooth movement, frontal undermining resorption, phases of the movement given by Burstone. It's a graph, you have to remember that. Tooth movement, bone bending theory by Farrar. Hi guys, sorry for the interruption. I am currently in Kullu going to do river rafting. So I thought I should complete the remaining parts of the orthodontics. That is the important topics I was telling. Okay, in mechanics, you have to do continuous forces, intermittent, interrupted, basic movement and forces, response of a tooth against various types of forces. In Anchorage, you have to do the anchorage according to the types of the tooth. Like canine have a triangular root, you have to tell that. Mandibular incisors have a flat root, you have to know what kind of anchorage they give. Round root, flat root, you have to remember that. Okay, in classifications, there's Moyer's classifications, Baker's anchorage, and ortho implants, temporary anchorage devices. You have to learn that. And the amount of forces, there is a chart, I'll try to add it in the video. There is a chart that tells about the movement and the amount of forces that is in the tipping, pure tipping, translation, root movement. You have to do that. Next, preventive orthodontics. You have to know the classification of components, lingual space maintainers, Nance palatal arch, distal shoe. Distal shoe is very important. You have to know that. It will also be asked in pedo. So learn it properly. What are its indications, contraindications, in what age patients it should be given. Then interceptive orthodontics, you have to know serial extraction, very important topic. Dual, Tweeds and Nance, like dual is CD4, Tweeds is DC4 and Nance is D4C. Gerber's space regainer, it also come in the interceptive orthodontics. Then moving on, methods of gaining space. You have to remember proximal stripping, distalization, pendulum appliance, the types of the pendulum appliance, what are the modifications of it, like Hilger T-Rex, Hilger PhD, you have to remember. Jones jig, distal jet. Arch expansion, RME, SME, that is rapid maxillary expansion, and slow maxillary expansion. Differences you have to run. Palate closures, at what age the palate closure occurs, primary, secondary palate. Appliances, tooth bond and tooth tissue bond. Like the tooth bond are the Isaac and Hyrex, and tooth tissue bond are Derschweiler and Hess. Timing of opening screw. See, I remember there are 2 classifications according to 2 scientists, so you have to remember that. Moving on, SME, you have to do quad helix, coffin appliance, night eye expander. Wilkinson's extraction, balancing and compensating extractions are the other topics that you have to remember. Removable appliances, bows, springs, elastics, and screws. You have to remember the examples. Just look in the books. There are multiple examples. You have to remember that. like Z spring, finger spring, labial bow, high labial bow, Roberts, Mills. Fixed appliances, you have to know the components, what are the active, what are the passive, brackets, types of brackets, size of bracket. There is a classification for the band size, you have to remember. And for the bracket types, there are three main bracket systems, that is the ribbon, tip edge and edgewise. You have to remember that, because according to them there are also classification of appliances. In active, you have to do arch wire, stainless steel, cobalt, chromium, nickel, beta titanium and nitide. For these four, there is a chart given in the Balaji book for friction, strength, elastic range, spring back and modulus of elasticity. It's an important chart. Questions are frequently asked from that chart, so you have to remember that. Fixed appliances, begs, edgewise, straight wire, lingual tech and tip edge. These 5 appliances you have to remember, because they usually ask, and also see the diagrams. For ortho, it is very important to see as many diagrams as possible, because there are many times picture based question. They will give an appliance and just you have to identify what appliance it is. Okay, stages of treatment. Different wires are used in different stages of treatment, so you have to remember, like aligning, leveling, finishing and settling. You have to remember that. Moving on, myofunctional appliances, very important topic, you cannot miss it, and I think at least 1 or 2 questions are every year asked for me, so you have to remember that. Classification, then the appliances come: activator, bionator, Frankel, Herbst, Jasper jumper, lip bumper, oral strain and twin block. For all these appliances I just told, you have to remember the names, the scientists which gave them, the classification of them if there is any, and the functions, and at what age they have to be given. Orthopedic appliances, you have to remember 2: headgear, that is cervical, occipital, vertical or combination, and the face mask. There are 3 face masks. You don't need to remember other than that, but there are sometimes Grumman's is asked, so you can remember Delaire, Tubinger, Petit and Grumman's. Sometimes Grumman's are not so much, but you have to remember at least Delaire, Tubinger and Petit one. And headgear effect, it's an effect, headgear and myofunction appliance effect. These 2 are the effects, you have to remember that. Moving on, management of malocclusions. Okay, midline diastema, crowding, rotation, class 2 and class 3. You have to remember at what age these occur. Are they self-correcting? What is the classification? And various things you can do to correct them or manage them. For cleft, cross bite, deep bite. Deep bite is the most damaging, you have to remember, and how you can correct it. Then comes cleft lip parrot, very important. It's asked in many subjects, like you will see questions from pedo, ortho, oral surgery, multiple questions and multiple subjects it covers. So you have to remember that the classification, types and the treatment and the time of the surgery which can be performed. Like you can do a cleft lip surgery at 3 weeks, I think 3 weeks, 3 to 6 months. Then a hard palate surgery by 12 to 18 months. You have to remember that. Then comes retention. Schools of retention, you have to remember. Riddle's theory of retention, you have to remember. Got disturbed. There was a crew coming for rafting. See. So I was telling about the miscellaneous topics which you have to remember. For example, Index of Orthodontic Treatment Needs. It's a new classification. You have to remember it has 2 parts: dental health and aesthetic part. You have to remember that it's a chart. I'll try to put the chart in the video, but if I don't, just see it online. Then the ratio of moment of couple to moment of force. There are various ratios according to the forces applied. Like torquing has a different ratio, body translation movement has a different ratio. You have to see that. Then yaw, pitch and roll. It's a concept of the tooth movement and the jaw growth. You have to remember that. Root resorption classification by Lavender. You have to remember, it's quite frequently asked. Okay, these are all the important topics that I remembered and I studied. Points that you should remember for studying ortho. First of all, see as many images as possible, because it's a conceptual and a visual subject. As much as you can visualize, as much as you can see the images, you will understand better and your concepts will be clearer. So remember that images are God for you. Then appliances. Appliances are very important. You have to remember the classification, functions and where they are used. Forces, the concepts. Try not to mug up, okay, and try to remember the concepts. It will be easier for you. Various charts for wires, appliances, They will help you learn better. And cephalogram, you have to remember that. Then moving on, the last but not the least, it's the most important one. You have to do revision, regular revision. I think at least once a month revision of ortho is sufficient for you, and with that you can remember ortho for a longer period of time. Okay, that's all for the video. If you like my content, please do subscribe and share the video. Thank you.